Hello everyone, my name is Dorian Daisaba. I'm an administrator at Marvin Mano. So welcome into this presentation. So today we're going to talk about an electronic health record that is going to replace the record that we were using, and that's because we were using papers and store them on file, but on a paper. So here we're going to look at the new system. As you all know that many of the hospitals are using this system, the electronic health record. So first of all, allow me to define what is electronic health records. Electronic health record, it's an electronic file record that is computer based. That's where we store the information, the patient information, and in those information we store all information that's concern a patient. For example, when we create for the first time an account for patient, we just ask him or her like personal information that's include name, address, and some of the information that we would like to know. And also from the new system, the electronic health record, you can access the information for a patient. Either it's like the medical prescription that the patient have been using like in the past, the prescription that another doctor from another hospital has been administrating him or her, and that will help us to know exactly how we can take care of that patient in case that the patient is coming from another hospital. And also there is a lot of importance of using this new system instead of using filing on papers. This is going to help us to reduce medical errors, as we have seen that as in many of those medical errors was the result of misinformation and misplacement of some of the files that we were using. So that's why I think that using this electronic health record is really better. So here we have some of the importance of the benefit of using this electronic health record. Here we have management of patient history, and this involves like as I said, that we have to store our information of the patient. If I have like the information of 100 patients, it will be easy for me to manage their history and to share their history with the doctors or any physician who is going to treat them. And here we have also the management of patient demographic, and this also will be easy because when we are still using papers, it's really hard to go and do a demographic report with those papers. But with this electronic record, the process will be easier. And also we have the access to result. As I said, that this we're going to talk about component of this electronic health record because it has so many. And there is one of the components which is going to help us with the payment of the payment of the bill, with which deals with the claims with the insurance that patients are using. And also we have we have like the process which is going to be easier to identify and store patient information. And so there is another very important point, which is sharing medical prescription. All those things that I said is some of the things that is done by the electronic health record. So welcome into the second part, where we're going to talk about the component of those of the electronic health record. So because of the time, as I say, that this has so many components, but we're going to explore more on what the electronic health record does with the clinical part, and what the electronic health record can help with the administrative part. So let's take two examples on the clinical part. On the clinical part, we have one of its component, which is called CPOE, which is computerized provider order entry, that helps in electronic documentation and nursing component. So this easier the process of decision making, such as drug and drug diagnosis interactions. So that because this components, what it does is to enter like information about specific medication that's a patient is taking, and also healthcare practitioners as physician. Of course, physician, I'm talking about physician, can be able to access or to find any diagnosis using this component. That's why I say that it's easier the process of decision making. For example, if a patient come in an emergency case, for example, let's say he or she might have an accident, and she's in intensive care, and she's or he's not even able to speak. So they, because of this computerized provider order entry, the doctor will be able to find easily a diagnosis drug to prescribe to this or to this patient. So this is very easy, and in case of we have some people in intensive care or in emergency. And the second one is medication administration record. This is also another component of electronic health record. This is going to help us. It's deals with recording the medication that a patient have been using in the past, or if ever a patient wants to go back and see like the history of medication that he or she has been taking, this is the right component to use. So the third part is to explore more about on the administrative components that can help us using the electronic health record. So we have ADT, which is admission, transfer and discharge functionality. So this is help us to create accounts to patient. As I say, that it has to be personal in order to like to follow rules under HIPAA, which is privacy rules. So this helps us to create patient information, where we create for the first time an account for someone who wants to use the electronic health record. We create an account to give him or her an ID, and also we ask him or her to create his or her own password, so that he might be able to log in onto his account if ever he want to access like medication, if ever he want to accept some of the things that we share via that electronic via ADT. So she or he might need to use his or her account, so that he may get access to that electronic health record component. So the another component that's help us in terms of administrative is the billing system. Here we have a billing system that help us during the process of payment for patients who don't use insurance. And also we have like under these components we have components that help us with the claims, with the for the for the patient that use insurance. So we use this to claim for insurance, and it's really easier and quickly, more than where we were using papers, instead of going back to the file that we have in papers and documentation. So we just send a report using this billing system, which is one of the components that's used by the electronic health record. So as I have been saying, that this is very important to use the electronic health record, because it helps the hospitals and all healthcare providers to increase to increase, and also to increase and to give like the best healthcare service to the patient. This is because according to the reports done by according to the reports done and the research, they have been find that there is so many things that has been solved in the healthcare industry due to the use of the electronic health record. So here we have like for example, as I said, like the electronic health record has been helping like healthcare providers to easier the communication between patient and physician. Since if you have like an account, as I said, in electronic health record, you can just get interacted, you and your physician, without moving where you are. And also there is access to patient information. This has been increasing the way patients access their information, because sometimes patients, let's take an example of accessing the results from the lab. For example, there are some results that healthcare providers can do, but the result can be but a patient can't get the results that day, and it may require the patient to come back and take the result. So this electronic health record has easier the process, because now a patient can access like the result or any information using this electronic health record, as long as she or he have like an account. And also this has easier the process of research in healthcare industry, and also the process of data driven decision, because now it is very easy to find like data, because we have those files where we store our patient information, where we store demographic, where we store different information. So this has easier the process of research in healthcare and this industry. And also it has enabled doctors to reach an accurate diagnosis more quickly. As I say that using this system, there is a company that might help like a physician to get quickly a diagnosis to some illness. And also this has reducing this has been playing a big role in reducing medical errors. As I said before, some of the medical errors were the result of misinformation, misplacement of some of the files. That, for example, if a patient go to the hospital today, and after 10 years he come back, he say that I have been to this hospital, I say this and this. Maybe we don't have that document that's proven that patient was given that medication or say this on this. So this has been to solve the issue of misplacement of file, and also like the problem of missing some of the information to the patient. So this electronic health record is very important, and I think it will be benefit that the Marvin Mano use this system, as we have shown that it's important, it's very important. But I would like also to highlight some of the things that are still barriers to the use of this electronic health record. As I said, it's something new, and it's really expensive. Some of the hospitals have been fearing to invest on it. And also there is a problem of scarcity of people who really have skills to use the electronic health records. And also they are still struggling with the how can like the electronic health record protect well the privacy of patients. And those are the barriers that are still an issue with the use of the electronic health records. But as we have seen, this has been helping different healthcare providers to avoid medical errors, and also to provide the best healthcare service to patients. So thank you. For any question or any concern, or if you want to explore more, there is a list of the reference. You may feel free to consult my reference, in order to learn more about this electronic health record. So thank you so much. I hope that in the coming days we'll be using this electronic health record. Thank you.